Now, also this morning, the Office of National Statistics are releasing more information about deaths from the virus in care homes, and this is a bit of a grey area. We're looking for clarification on that. Here to put those numbers into context for us, the Chief Executive of Care England, Professor Martin Green. Professor, good morning to you.
Good morning, Eamonn. Good morning, Ruth.
Good morning.
Professor, what are we hearing? Because we haven't had much to go on yet, and it's a big area of concern, care homes.
Yes, I think one of the challenges has been that we have not had very good statistics, and the statistics that we were working on were very much the statistics which were at the start of the pandemic. I think what we're going to see from the ONS statistics is a significant increase. Now, the government said yesterday that a lot of care homes, and in fact, about 2,000 care homes have got some of that virus. And I think the thing we should also recognise is that every single person who is in a care home is in the high-risk group for contracting COVID-19 and also for having some really severe consequences, because everyone in care homes have lots of different health conditions. So I think what we will see today with these statistics is a significant rise in the number of both infections but also deaths, sadly.
But why haven't they been including these numbers in the daily figures that we hear in that press conference every day, Professor?
Well, I don't know, Ruth, and I think we've got to get some statistics, and I really want to see statistics that are daily delivered. It's not only about people who are in NHS hospitals, but we need to have a really clear understanding about the numbers of people who are both infected and dying. And that, of course, links to having to get some really clear testing. We need testing for every single resident in a care home, and particularly in a care home where people are showing symptoms. We also need testing for staff, because one of our big challenges is the number of staff who are having to self-isolate. So those are two areas where we need to really up the number of tests so that we can be really clear as to the scale of this pandemic in care homes.
And also, there is a thing that we've got to separate here, Professor, all of this, and that is the question, are you more likely to get COVID-19 if you're in a care home, or are you just more likely to die if you're in a care home? So there's a subtlety, there's two different things.
Well, I think there are different things, but I think, Eamonn, we have to acknowledge that anybody who's in a care home is going to be in a very high-risk group. Nobody is in a care home unless they have several health conditions, and people are extremely frail normally when they're in care homes. So tragically, if you do find yourself with this virus in a care home, there is going to be significantly extra consequences because, of course, you are frail and have lots of health conditions. Yes. And actually that goes for people living in the community as well. Let's not forget there are lots of people who are very frail with lots of health conditions being supported fantastically by our home care colleagues as well. So the problem, I think, is not about whether people are in care homes or whether they're in the community. The issue is whether or not they're in high-risk groups. And obviously, people who are in care homes are in that category.
Yes, I get that, Professor, but I suppose the long and the short is that people who have family in care homes, and we fall into that group ourselves, are going to be saying, is it more dangerous for my relative to be in a care home? Would I be better off getting them and bringing them out of a care home?
Well, I don't think it's the time to bring anybody out of a care home. And let's not forget that care homes are very practiced on infection control. You know, every year our colleagues in care homes deal with seasonal flu, they deal with norovirus. They are well practiced in how to do infection control. And certainly I think anybody whose relative is in a care home will obviously be worried. But now is not the time to move them, because there are significant risks, as we know, from being moved and indeed out in this particularly dangerous time. So I would say to people, I can understand your worry, but rest assured care homes are doing absolutely everything they possibly can to keep people safe.
They are, and those staff are incredible. We talk about, NHS frontline staff, but obviously staff in care homes and carers going out into the community, also frontline. A lot of them very frightened and worried, though, because in the care homes they do not have, a lot of them, the personal protective equipment at all. They don't have masks, they have gloves, but a lot of them don't have masks, they don't have the aprons, and they're putting themselves at risk. Have you heard about maybe staff not wanting to go into work or people walking out?
Well, I think one of the things to say, Ruth, you're absolutely right. The staff are absolutely amazing and they have shown so much commitment. And I certainly think there was a major problem about the allocation of PPE at the start of this pandemic. But I know colleagues in the Department of Health and Social Care have been working very hard to try and make sure that there is now an adequate supply. And I think what we should be seeing is the PPE should now be getting to frontline staff. And if it isn't, then there are mechanisms whereby people can identify that, and hopefully we should see the supply chain getting much better. But I really agree with what you say, Ruth. I mean, people must be very worried if they're working in an environment where there could be lots of people who are COVID-19 positive. And that is, again, the reason we need to have testing. We need to know who is COVID-19 positive so that we can support them appropriately, so we can make sure that very high levels of PPE are used, and so that we can make sure that we contain this pandemic as well as we possibly can in this very difficult time.
Professor, really appreciate your time and your analysis on things this morning. It's a very, very busy and stressful time for you as well. So thank you, very much indeed. Professor Martin Green's the Chief Executive of Care England. The latest figures that we're getting from the Office of National Statistics released today, this is at local authority level and it runs up until the 3rd of April. They're showing COVID-19 deaths in care homes in England in 1 week, 217.
Which is up from the previous week, and that's only until April the 3rd.
Yeah, it's all quite complicated. These numbers will be crunched and we'll have more trends or more relevant trends on those when we get it towards the end.
But I know a lot of you watching who have family and loved ones in care homes, so it's a very worrying time for everybody, isn't it? Or you might have a family member who's a carer in one of those care homes, but they are doing an amazing job under difficult circumstances.